Welcome to the second day of the summit. It's really early. It's a Friday morning, a very typical one here in Vancouver, raining. If you're from out of town or if you have limited data on your phone, there's Wi-Fi here, and the password is, the username and the password is on the screen, so I was told to just spread that message. All right, so we have a really exciting panel with us today who's going to be talking about innovative approaches to undoing stigma. And each presentation will be 20 minutes long. And at the very end, we'll have a 10-minute Q&A session. So if you have any questions whatsoever, just write it down on a piece of paper, and we'll make sure to address those at the very end. Okay, so first up, we have Elmer from VU University Amsterdam. Eddie is currently working on his PhD in gerontology, studying the influence of minority stress on loneliness in older LGBT adults. He's also a member of the City of Vancouver Seniors Advisory Committee and was a past liaison to the city's LGBTQ Advisory Committee. And today, Eddie is going to be sharing with us the pain with many faces, challenges in identifying chronic loneliness in older gay men. So, all yours.
So, good morning, everyone. Last year, I did a presentation on loneliness and older gay men, and I presented a very broad biopsychosocial model of why older gay men are at heightened risk for loneliness. But I didn't have too much time to go into detail about an important point, which is the distinctions between loneliness and other states and traits which resemble loneliness. So I'd like to talk a little bit more about that today. And I should warn everyone, last night I took a sleeping pill, so I'm a bit loopy this morning. So if something does not make sense in this presentation, you can attribute it to that. So first I'm going to talk about what loneliness is, briefly, this tremendous stigma surrounding loneliness, prevalence, how many people are lonely, risk factors for loneliness, adaptive and maladaptive loneliness. There's actually two different types. One is good, one is bad. Distinction, then I'm going to get into the distinctions from other states and tips for differentiating loneliness from these states. So what is loneliness? Many different definitions, but a really broad one is any situation experienced by the individual as one where there is an unpleasant or inadmissible lack of or quality of certain relationships. So it basically reflects a mismatch between the relationships you have in terms of quantity and quality and what the ideal relationships are in terms of quantity and quality. And the emphasis is more on quality than quantity. It's important to know it's a subjective experience. It's not like objective social isolation. There are some people who have very small social networks, and they're not lonely at all because they're satisfied with the quality of those networks. And then there are people who have hundreds and thousands of friends, and they feel tremendously lonely. We can be lonely surrounded by many people, be lonely in a crowd. Loneliness is not trivial. It's a miserable, painful, gnawing feeling. It's not subtle. And there are three basic types of loneliness. Intimate emotional loneliness is the perceived absence of a really close, intimate emotional tie, like with a partner or a really close friend. Social loneliness, which is a perceived lack of a broader network of friends and coworkers who provide various types of support. And collective loneliness, which is a perceived absence of a meaningful connection with some kind of group or identity that is beyond the level of individuals. So feeling part of a work team, religion and ethnicity, in our case, an LGBT community or communities. And loneliness can happen in any combination, although intimate emotional loneliness seems to be more common, and it's what's associated with the various health problems that we see in older gay people, and all gay people, actually. So loneliness is a tremendously stigmatized, I shouldn't say condition, a state. And when you ask people what they think about when they hear the word lonely, they think of sadness, depression, person being antisocial, awkward, creepy, a loser. And when we think of men and loneliness, certain really negative images come to mind. People who are told that they're going to have an interaction with somebody who's lonely, even if that person is not lonely, they tend to react quite negatively to that person. They talk to them less, they act in a more hostile manner. So people have these stereotypes, and then they actually act on the stereotypes, and they confirm for people who are lonely, they confirm their negative expectations about relationships. 1 in 3 people would be embarrassed to admit feeling lonely, and they would actually rather admit to having some kind of serious psychiatric disorder like schizophrenia, depression, rather than loneliness, because a disorder is something that people think is brought on upon you from the outside. It's not your fault, but if you're lonely, there's something fundamentally wrong with you as a person. And this is why we often avoid using the word lonely on the different scales that are used to measure loneliness. Now, being lonely and gay is like really bizarre to a lot of people, particularly outside of the gay community. They think, how can you possibly be gay and lonely? We have images of very happy gay people, lots of friends and parties and clubs and bars and greater societal acceptance, and now we have same-sex marriage. Yet, gay people are, especially older gay people, more likely to be lonely than heterosexual people. By way of prevalence, loneliness isn't something that just happens in older people, it also happens in younger people, and there's this interesting U-shaped curve. What we're most concerned about is people who have severe levels of loneliness, which is about 5 to 10% of people in midlife, and up to 15% in people who are quite a bit older. And with older gay people, we see even higher rates on the upper end. Older gay people are about twice as likely to be lonely compared to heterosexuals. Trans older people are especially likely to be lonely. And we're not really sure about gender differences. There's mixed results on that. A big survey came out recently showing that 32% of older gay people, 50 and over, are concerned about being lonely, growing older. And the comparable rate among heterosexual people is about 20%. Now, there's a whole bunch of background risk factors for loneliness. I won't go into all of them. But being isolated without choice, unrequited love, divorce, bereavement, those are big risk factors. Living alone, but only if you don't have other supportive relationships outside the home. Not having a spousal confidant or a similar relationship. Relationship quality, again, I mentioned before, that's really, really important. So being in marriage is generally protective against loneliness, but if it's a bad marriage, it's not protective. It actually increases loneliness. An interesting one is collectivistic culture. People from those cultures actually tend to experience greater levels of loneliness. Health, illness, immobility, and even stereotypes of aging as a time for loneliness are all risk factors. Loneliness can happen to anybody, but we're particularly concerned about loneliness in older gay men because they have many more risk factors than their heterosexual counterparts, more likely to be single and living alone, tend to be more estranged from their families of origin, fewer children, particularly older ones have lost some of their social networks to HIV/AIDS. They have more health problems, more immobility, and we have evidence that that may be due to stigma. Ageism, looksism, racism within the LGBT community, particularly online, and also what we call femphobia. There's tremendous stigma against anybody who's actually feminine. That's definitely a risk factor for loneliness. Minority stress, we have evidence that concealment, discrimination, expecting to be discriminated against, and internalized homonegativity all increase risk for loneliness because they tend in various ways to interfere with relationships, and they can lead to excessive rejection sensitivity. Loneliness is also, it's an added stressor for this population. They've already experienced a lot of stress in their lives, especially those from the pre-Stonewall generation. And this adds to the cumulative overall health burden that they experience on account of this stress. And by stress, I particularly mean stigma. And this is on top of the regular age-related declines in health that we see in older people. And there is some evidence that the link between minority stress and negative mental health and physical outcomes may be due to loneliness. So, having discussed that, I want to talk a little bit about why, if loneliness can be such a bad thing, why does it happen? Why does loneliness still exist in the gene pool? And the reason is we are fundamentally social species. We're born to one of the longest periods of abject dependency compared to all other animals in the animal kingdom. We rely very much on other people to survive throughout the lifespan. And it's posited that loneliness evolved like a biological pain signal like thirst or hunger or physical pain to warn us when our needs are not being met. And one of the important needs is social connection. So essentially, the capacity to feel loneliness when we perceive isolation helped us to survive, to reproduce, and to help our offspring reproduce, and thereby transmit our genes to the next generation. Now, if there are any creationists in the room, this probably means nothing. But, and there's some evidence for these deep evolutionary roots to loneliness. About 50% of the variation in levels of loneliness between people tends to be accounted for by genes, and we know that from twin studies and adoption studies. The cycle of loneliness that I'm going to describe tends to be very automatic and unconscious. Loneliness shares the same brain systems as physical pain, which is a very primitive system. And we also see similar behaviors in other species that are isolated from preferred social partners. It's an interesting line of research there. Most loneliness is actually transient because it does what it's supposed to do. It encourages us to reconnect with people. But it encourages us to reconnect in a tentative manner. So when we perceive isolation, we're motivated to reconnect, but we also withdraw and we become hypervigilant for possible social threat before we reconnect. And that can be helpful. It helps us step back and analyze the situation, because when we're alone, it can be quite to be alone on the social periphery can be quite dangerous because we don't know who to trust. And we also don't know if we've done something to cause our loneliness, to cause our expulsion from the social group. So we want to reconnect, but do so tentatively. We want to understand the situation, make sure that it's safe before we reconnect with people. When we judge the situation to be safe and when we change our behavior if required, we reconnect. Now, in some people, this process goes haywire. The withdrawal and the hypervigilance for social threats become really excessive, perhaps because these people are in severely isolating circumstances. So we know that people in prisons, for example, tend to go absolutely psychotic when they're put in solitary confinement. Some people really do live in really severely isolating circumstances. Chronically rejecting environments, like being in a nursing home that's not friendly to LGBT people, and there are quite a few of those. Innate distrustfulness of people, and perhaps a genetic predisposition to misperceive information or to focus too much on negative aspects of interactions. This leads to a chronic self-reinforcing cycle of loneliness where people perceive isolation, they are more hypervigilant for threats, they pay more attention to and perceive more negative intent in social interactions, and as a result, they tend to behave in sort of a standoffish way with people. They can be a bit snobby. They push people away when they actually want social support from other people. And this is a sort of very self-protective behavior. And of course, other people respond to that in a negative way. And then lonely people believe that confirms their belief that people are very rejecting and can't be trusted. And so that leads to more negative social interactions and this cycle of loneliness that people can't get out of. And this leads to all sorts of stress and disruptions in sleep. And it also leads to general emotional dysregulation, which leads to various poor coping patterns that we tend to see in some older people, older gay people. Less self-care, not exercising, overeating, more use of drugs and alcohol, excessive porn consumption. Seeking partners online actually is associated with loneliness. Riskier sex, excessive use of social media, and particularly passive use of social media. Lonely people tend to use social media. They look at pictures, but they don't actually interact with people. They just sort of compare their lives, their social lives to other people's social lives, and that just makes them feel lonelier. They tend to have a fatalistic attitude towards life. They feel they have no self-control, and they end up coping very passively with life challenges. So given the chronic effects of loneliness, which is basically a chronic fight or flight response, and this negative style of coping, it's not surprising that loneliness is a predictor of all sorts of health problems, including immune dysfunction, which is of particular import in this population. And it's also increased with, associated with a 30% increased risk of death within about an 8-year period, which is comparable to other risk factors for early mortality. So to summarize, this cycle is very, very difficult to escape, and it can't be alleviated merely by giving people access to more friends or providing social support, because lonely people tend to reject the support that they're given. This is why most of these interventions fail. So in summary, people become lonely due to circumstances and perhaps some kind of genetic predisposition to sensitivity, but they stay lonely because of the way that they perceive social situations. So I'm going to talk about some distinctions. We often confuse loneliness with solitude. Anthony Storr writes, this is a great book about solitude. Solitude is a pleasurable isolation. It's time spent alone to pursue activities that you enjoy. Loneliness is unwanted solitude. We think often the lonely person is just an introvert, but introverts just have a lower preference for social contact. As long as their needs are met, they're not likely to be lonely. We often think lonely people are antisocial. Actually, lonely people want very much to connect with other people. They're just afraid to do it. Sometimes we think a lonely person is just being a jerk, but not really the case, because loneliness is sort of, it's not a conscious thing. It's not intentional. We think the lonely person is just being a snob. Snobs, interestingly, they tend to be quite selective in who they're snobby with. Lonely people tend to behave in a snobby way more generally with everybody. Shyness, it can be a cause of loneliness if it's excessive, but we know from experimental manipulations of loneliness that loneliness can actually increase feelings of shyness, as well as low self-esteem, depression, anxiety, and a lot of those other behaviors I talked about in that cycle. We think sometimes the lonely person, they just have low self-esteem. Self-esteem and loneliness are actually very much intertwined. Self-esteem tells you whether you're being accepted by your social group. So it's not something that's really internal, it's something that's very sensitive to the environment. So the two they're inseparable. They're not two distinct constructs. We think maybe loneliness is just not having enough social support. You can have a lot of social support, but if the people providing the support are not people you actually like, you'll still feel lonely. Internalized homophobia could be a cause of loneliness, but it could also work the other way, so that when people are lonely and they become more negative, they're going to focus that negativity on the people that are around them. And for gay people, it will tend to be other gay people. We often think loneliness is sort of the same thing as just having poor social skills. No, lonely people actually have very good social skills. They just don't use them in the situations they need to use them in. It's also very different from Asperger's, which is sort of an innate childhood disorder. The biggest distinction is between loneliness and depression. Loneliness is something that prompts us to reconnect with people, although in a tentative manner. With depression, we just withdraw from life altogether, relationships and everything. In loneliness, we're hypervigilant for social threats. In depression, we just have very intense sadness or no feelings at all. In loneliness, we're critical of self and others more in particular. In depression, we're just intensely critical of ourselves. In loneliness, we misperceive social cues. In depression, sometimes we can become quite delusional. Loneliness reflects how we feel about relationships, and depression reflects how you feel, period. Lonely people have some insight into the cause of their problems. They understand that the problem is lack of social contact. In depression, people have often no insight. They have no idea why they're depressed. And finally, in loneliness, there's some ray of hope. You believe that if you get social contact, your loneliness will subside. In depression, you just feel helpless about everything. Hopeless, rather, and helpless. It's important to note that loneliness is more likely to cause rather than to be the consequence of depression, and we know this from longitudinal studies. And we also know that depression, does it mean I have 1 minute left? Let's skip through this. We tend to focus a lot on depression because it seems very serious, and loneliness seems very, very trivial. We have treatments for loneliness, but we have treatments for depression and not easy treatments for loneliness. And depression tends to be less stigmatized than loneliness. And there are various, by focusing on depression and not loneliness, we're not looking at the root cause. We're often using harmful treatments that are ineffective, and we perpetuate the stigma of loneliness because we don't actually talk about it. Finally, some tips on identifying loneliness. It's important to become familiar with the cycle that I described, to recognize this pattern, this cluster of behaviors, to watch for maladaptive coping, to look at your own discomfort in social interactions. If you feel that interactions are kind of off, something is not right, that's a sign that perhaps the person is stuck in this cycle of loneliness. Think about context. Is the behavior in response to social stresses or just general all stresses in life? Does loneliness happen before, in the case of depression, does loneliness happen first or does depression come after? You can use various measurement tools to measure loneliness, and we have a few of them. And finally, you can actually just broach the topic directly with somebody. Even though there's a lot of stigma and people can feel very embarrassed to talk about loneliness, they often feel great comfort when you actually mention the word. Although if you really feel that the person will be quite embarrassed if you talk about it, you can always talk about it indirectly. You know, I read a study about lonely people, or I know a lonely person, and that will often invite the person to talk about it even if they don't want to talk about it right away. So main point of this presentation is to keep these distinctions in mind and not to assume that loneliness is any of these other things. It's more often the case that it's loneliness rather than depression or these other factors. Thank you.